In 2006, a woman named Monique White was suffering from lupus, an inflammatory disease caused when the immune system attacks its own tissues. She was unable to get treatment due to her lack of health insurance. One night, her mother explains, her pain began to increase, and her mother wanted to take her to the hospital, but not because she did not have health insurance. The next day, she suffered a seizure and was rushed to the hospital, but it was too late for treatment, and she died a few months later. Unfortunately, stories like Monique's are not rare in the United States, and many of American citizens are affected by this due to their lack of health insurance. This is why the current U.S. healthcare system should be switched to one singular universal healthcare plan. The first reason why it should be switched to a universal healthcare plan is the current U.S. system is extremely expensive. Of the world's 25 most wealthiest nations, the U.S. is the only nation that still does not have a universal healthcare plan. It has the biggest healthcare industry, which comes in at approximate $3 trillion each year. By 2018, healthcare will comprise to 18% of the gross domestic product in all of the United States. As you can tell, the health insurance is a huge industry in the United States, and it could be due to this. A lot of private organizations make a lot of money just from not helping people or not deciding to sign people into their contracts. Despite spending the most money out of the 13 most developed nations, we have the lowest life expectancy, highest infant mortality rates, and highest rates of heart disease and amputation due to diabetes. So if we're spending so much money into the industry, and why are all of our numbers not? Why don't we have the highest life expectancy, the lowest infant mortality rate, and why are so many people dying due to diabetes? In 2016, taxpayers paid 65% of the country's total health care expenses for Medicare, Medicaid, the State Children's Health Insurance Program, the Department of Defense TRICARE, and TRICARE for Life programs, the Veterans Health Administration program, and the Indian Health Service program. Those are all government-funded health insurance, but you can only qualify for them if you have specific standards. I know Medicaid is if your income is low enough to, if you make a low enough income, you can apply for Medicaid, and you can get free health care. Keep in mind, though, that on top of the tax that people had to pay for those healthcare programs, if you did not have either one of those healthcare programs, you also had to pay for the private healthcare plans every month, combined with how much you have to pay on personal procedures that are not totally covered by the plan, as well as a co-payment every time you go see a doctor's. For example, when you go and get a physical, a lot of the times the doctors, you hand them $20 in cash or whatever payment you choose to pay in. In other countries, when you go to the doctors, you show up. I know in Europe or in Spain, most countries in Europe have a universal health care plan. You show up, the doctor takes you in. You don't even have to bring in any. You don't have to bring in any money if you don't want to. You don't even have to have money. You just have to be a citizen and pay taxes. Second, the universal health care plan would result in less spending if switched to it. In Canada, where there is a universal health care system, taxpayers pay 70.6% of the health care expenses, which means that the U.S. taxpayers are already almost spending enough to fund the universal health care system. So if the U.S. is paying 65% of taxes due to health care on top of you also have to pay for the private health care plans. If we're already paying 65%, why don't we just switch to one universal health care plan, and then you won't have to pay for the copayment in the private industry. Physicians for a National Health Program estimates that private insurance bureaucracy and paperwork consumed 1/3 of every healthcare dollar. Streamlining payment through a single nonprofit payer would save more than $400 billion per year, enough to provide comprehensive, high-quality coverage for all Americans. This means that for all the money spent into the healthcare program, 30% of that is going to a private organization. So cut all that out, that would equal $400 billion per year that is being saved by Americans. Lastly, with a free market healthcare system, citizens can be denied coverage. As I mentioned in the beginning, since when you don't have health insurance, a lot of times if you try to get it, private organizations can deny you because they don't make money off sick people, they make money off healthy people. So unregulated health insurance companies are financially rewarded for not accepting sick customers and punished if they do accept them. Companies gain profits when their customers are healthy and lose money when their customers are sick. Private healthcare employers are rewarded when they find that sick customers who now need the coverage because they're sick and they need to go to the doctors had a pre-existing condition that was not mentioned before. If your provider finds a pre-existing condition that you did not mention to them, they do not have to cover you. So they will actually go and look through all your records just to find any pre-existing condition that you did not mention, just so they cannot cover you. As Americans, we should not be okay with other Americans dying because they cannot afford to acquire proper coverage. A universal healthcare system would be less expensive and more effective than our current system. As voters, we need to consider this when deciding who to vote for.